Acan Rung Rawi bukan ya? Rung Rawi bukan ya? Bukan ya? Belum tahu ya? Good morning, Acan Rung Rawi.
Good morning. Can you hear
Can
me?
you hear my voice clear?
Yes, very clear.
Yeah, thank you for coming this morning, Acan, for our seminar.
Thank you very much that
Wow, so
give me an
beautiful
honor.
today.
Okay. Can you hear me?
อาจารย์คะ
Ah,
now we register for the participants and we will waiting for the participants come to the link.
I thought that the voice is echo, quite echo, because you have to stop one of the instrument or make it distant. Okay. Again, please. You stop.
Check. Okay, can you hear my voice clear?
Yes, okay.
Okay, now we waiting for the participants come to the link.
Okay.
Because, yeah, until 8 a.m. we will register the participants.
Mhm. Okay, if the team is ready, you can tell me because I'm waiting for in front of the instrument already.
Yeah, okay, Asan.
Okay.
Selamat pagi.
Kegiatan vaksinasi ini untuk menjangkau kelompok-kelompok rentan. Jadi kelompok-kelompok rentan ini memang kita butuhkan terjangkau. Karena apa? Karena dia merupakan kelompok rentan yang harus dilindungi, tetapi mungkin aksesnya terhadap vaksinasi ini belum bisa optimal.
Di bulan Juli hingga September 2021, cakupan vaksinasi di DIY masih relatif kecil. 40,53% warga telah divaksinasi di bulan Juli, 57,27% di bulan Agustus, dan 81,94% di bulan September.
Teman-teman yang lansia, kemudian teman-teman difabel itu entah susah mengaksesnya, entah tidak dapat informasinya atau tidak tahu, terutama bahkan ada yang menolak vaksin karena informasinya belum dapat. Jadi itulah kenapa kami ingin menyasar kelompok most at risk yang benar-benar terpinggirkan atau belum mendapat akses.
Misalnya saja lansia, banyak lansia yang kemudian komorbid. Mereka harus stay di rumah, mereka bed rest, mereka nggak bisa kemana-mana. Kemudian yang kedua, itu disabilitas. Dengan berbagai hambatan, baik itu hambatan tuli, hambatan netra, hambatan sensorik, dan sebagainya. Mereka kesulitan juga mobilisasi, karena jalan untuk ke puskesmas itu juga cukup jauh.
Kami ormas, termasuk ormas, dan kemudian ada kader, ada pemerintah, desa, juga tokoh agama, tokoh masyarakat itu membantu kami. Plus kami juga ada kesempatan berkolaborasi dengan private sector.
Nah, bagaimana juga disabilitas yang ada di Jogja?
Beberapa ada yang kita harus ke dinas lokasi, pasti Medan. Kadang itu kita dari orang kayak gitu. Atau mungkin kita juga minta tolong ada kerja yang difabel itu.
Di mana tim YEU
Kalau komunitasnya terpenuhi, vaksinasinya preventifnya, pencegahan.
714 orang.
Edukasi yang lebih mendalam.
Sudah bisa mobilitas, kami bisa membantu kami untuk vaksinasi secara door to door.
Cek suara monitor aman dari laptop Bu Nur ya, teman-teman.
Cek Mas Krishna,
Ya.
suaranya itu kok spellingnya nggak jelas ya?
Oke, selamat pagi. Saya
Oh iya,
dengan Krisna.
lumayan. Sudah.
Sudah ya?
Aman.
Tes aman ya? Oke, terima kasih.
Siap.
Selamat pagi Mbak Reni.
Selamat pagi Pak.
Bagaimana pagi ini?
Sudah agak lumayan Pak.
Ya, gimana dengan keluhan kemarin ada batuk, sesak nafas sudah berkurang atau sudah hilang pagi ini?
Sudah lumayan berkurang.
Nah, sudah baik ya. Ya, baik Mbak Reni. Jadi dari hasil visit dokter pagi ini, pemeriksaan dokter pagi ini, walaupun mungkin belum sembuh total, tetapi kondisi Mbak Reni saat ini sudah memungkinkan untuk rawat jalan. Jadi sudah diperbolehkan pulang dan nanti tetap walaupun sudah pulang tetap harus melakukan isolasi mandiri. Begitu nggih Mbak Reni?
Baik Pak.
Ya, jadi untuk tindak lanjut dari perawatan di rumah, walaupun nanti di rumah, nanti kami tetap akan melakukan pemantauan ya setiap harinya sampai batas waktu isolasi mandirinya selesai. Ya.
Halo, selamat siang, PT Dayakum Care Center.
Halo, selamat siang Bapak. Perkenalkan saya Reni.
Jadi nanti
Nanti saya COVID gitu.
Pelayanan kami dan pihak koordinator.
Nanti saya ngomong nih, kecamatan, kelurahan, RT dan RW, supaya kalau ada yang kena, intinya kan gini, intinya mengatasi pandemi ini cuma satu kan, yaitu mengurangi laju penularan, flattening the curve. Itu banyak kali yang udah di WA group keluar. Nah, caranya seperti apa? Kalau kita nemu orang, dia harus diisolasi supaya tidak menularkan.
Cek. Teman-teman co-host, 2 menit lagi admit peserta ya. Siap, tolong ready dengan sinyal kalian, tolong ready dengan device kalian. Semangat untuk berjuang bersama. Nanti berapa menit? Nanti kami aba-aba kalau sudah mulai untuk admitting peserta ya. Terima kasih. Cek. Guys, teman-teman, co-host, silahkan kalau mau mulai admit 1 menit dari sekarang boleh dimulai. Cek teman-teman co-host, silahkan admit peserta. Siap, semangat. Semangat.
Good morning to all participants. Thank you for joining our international seminar. Before we begin, please fill out the initial registration link in the chat box. To all participants, this is a reminder. Make sure you have access to the initial registration link. If you have not done it, please check the chat box to get the link. Dear participants, for those who have not filled out the registration link, you might check the chat box and fill out the initial registration link in the chat box. Dear participant, allow me read the rules of our international seminar. First, make sure your Zoom ID is in the following format: full name with a title, underscore name of institution. Second, the participants should attend the seminar from the beginning to the end. Third, the participants are required to fill out the registration and evaluation form. The certificate will be made based on the information given. Therefore, any errors caused by incorrect data input is not the committee's responsibility. Fourth, the participants should wear proper attire. Fifth, the participants are allowed to activate their audio and video under the committee's permission. Sixth, the participants who would like to ask can type down the question in the chat box with the following format: name, underscore country, underscore speaker, underscore question. 7. An evaluation link will be provided 30 minutes before the seminar ends. Participants who do not fill out the evaluation link will not be given a certificate. Dear participant, let me read once again the rules of our international seminar. First, make sure your Zoom ID is in the following format: full name without title, underscore name of institution. Second, the participants should attend the seminar from beginning to the end. Third, the participants are required to fill out the registration and evaluation form. The certificate will be made based on the information given. Therefore, any errors caused by incorrect data input is not the committee's responsibility. Fourth, the participants should wear proper attire. Fifth, the participants are allowed to activate their audio and video under the committee's permission. Sixth, the participants who would like us will type down the question in the chat box with the following format: name, underscore country, underscore speaker, underscore question. 7. An evaluation link will be provided 30 minutes before the seminar ends. The participants who do not fill out the evaluation link will not be given a certificate. Jaipong traditional dance. What a beautiful performance. Thank you. Elena, Elke, Nikade Ade, Agnes, and Putu Indah for the wonderful performance. The distinguished speakers, the respected guests, and all the speakers, and all the participants, good morning and welcome to our international seminar entitled Community Nursing Services During the COVID-19 Pandemic. I am Elena Rizika Fitra, will be your host today. It is such a pleasure for me to be able to welcome you all in this forum this morning. First of all, thank you for making your time and joining us right on time. We hope that all of us can get a lot of insights from today's forum. Ladies and gentlemen, to begin our seminar, let us start by praying, asking God's blessings so this event will be running smoothly. The prayer will be done in Christian way. For those who have different belief, kindly support us in your prayer. Let us pray. Dear God, as we gather this morning, we thank you that you promise to be with us always and that your presence with us right now. Lord, thank you for allowing us today to meet and share our knowledge and time with one another in this seminar. May you extend your divine wisdom to our speakers so that they will be able to impart their God-given knowledge to all of us. May they be blessed as they continue to bring their expertise to people who need them. Bless all of us as the participants as well, so we will be able to glean the filtered information from this seminar. We ask this for your glory and praise. Amen. Ladies and gentlemen, it's an honor and such a pleasure for us. Today, we have one keynote speaker coming from Thailand. Her name is Assistant Professor Dr. Rungrawi Navicharin. And we also have three amazing speakers. They are Mrs. Annunciation Titaloxing DNS from the Philippines, Mrs. Nurlia Ikaningtias, SCUP Nurse, MCUP, SPCUP MB PhDNS, and Mrs. Arsinta Sumarsono, SSI MPH from Indonesia. Good morning to all speakers and thank you for making your time for us this morning. Ladies and gentlemen, allow me to invite you to rise and sing our national anthem, Indonesia Raya. Continue with the March of Indonesian National Nurses Association, PPNI. All participants, please stand up.
nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk menghantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu, serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Ladies and gentlemen, you might be seated. Now, I would like to invite the head of Bethesda Yakum Institute of Health Science to give us a welcoming speech. To Mrs. Nurlia Ikaning Tias, SCOP Nurse, MCOP, SPCOP MB, PhD ANS, the time is yours.
Thank you, Elena. Good morning, everyone. The honorable speakers, Mrs. Assistant Professor Lungravi Navicharan from Thailand, Mrs. Anusition Tetalosik GNS from Filipina, Mrs. Arsinta Sumarsono, SSA MPH, the Honorable Mrs. Dr. Randa Penny Rahayu MM from Yaku, and Mr. Bondan Palestine, SKM MCAP SPCOM from the Indonesian National Nurses Association, and all participants. Let us first give thanks to God Almighty for His love that we can gather in this place in the healthy condition. I would like to thank all the speakers who have taken the time today to share their knowledge. Also for our partners who supported us in organizing the international seminar and national call for papers today. Komisariat PPNI Stikas Bethesda Yakum, Politeknik Kesehatan Karya Husada, and Stikas Jayapura. I would also extend my warm regard to all institutions who have sent their participants to be present in our parade session. From Akbar Bina Insani Sakti, Kota Sungai Penuh, Stikas Purnyo Cendekia Medika Pangkalan Bun, Institut Kesehatan Immanuel, Politeknik Yak Permas Banyumas. The distinguished speakers, guests, and all participants, the COVID-19 pandemic might have asked, but there are many things we can learn from this pandemic, especially how the community plays an important role in dealing with this pandemic. Therefore, today the theme is chosen so that we can learn from the experiences from 3 countries in that dealing with pandemic in society. If right now we can go through this pandemic, it's possible that there will be another pandemic in the future. Thus, we need to be ready for all possibilities. Finally, I wish you all an enjoyable and fruitful discussion throughout this seminar. God bless us all. Thank you.
Yogyakarta is a private health science institute located in the heart of Yogyakarta. It belongs to Yakum, Christian Foundation for Public Health, one of the largest health service foundations in Indonesia. Stikes Bethesda Yakum Yogyakarta has been through substantial change for more than a century. Founded as Zeningsen Kenhuis Petronella Health Service in 1889 and changed into an Institute of Health Science in 2009, Stikes Bethesda Yakum has become a center of health science education. Caring with love is our core value, in which we are committed to it to guide our practice in ethical and sustainable ways in conducting the learning process and community development. Currently, our status of accreditation of BAN PT is B, and we will continue to improve the quality of our education as a health science institute with high competitiveness. Stikes Bethesda Yakum Yogyakarta has 3 study programs accredited B by LAM PTKes. They are Diploma 3 of Nursing, Bachelor of Nursing, and Nursing Profession Education. Being part of global educational institution, our students come from different provinces in Indonesia. Even some of them are international students. All of the students are given the same opportunity to learn and to accept knowledge. The diversity in ethnic groups, religions, and cultural background makes us Stikes Bethesda Yakum Yogyakarta a multicultural campus. Stikes Bethesda Yakum Yogyakarta is committed to provide learning opportunities to talented students to its extensive scholarship programs. They are KIP Kuliah, Ristek Dikti, Dikpora DIY, Eka Cipta Foundation, Bank BRI, Bank BPD DIY, and PT Astra Honda Motor. The education quality assurance is proven by the outstanding result of the National Nursing Competence Examination with the graduation rate of more than 90%. A various facility and service for the students provided by Stikes Bethesda Yakum Yogyakarta is as follows. The Nursing Laboratory. The laboratory is designed in such a way to replicate the clinical scenario in hospital. The room is divided into medical surgery nursing, pediatric nursing, maternity nursing, mental health nursing, and community nursing. Utilized with a complete and up-to-date simulation aids with a ratio of a set of 8 for 10 people, students have equal chance to make use of the nursing laboratory based on the schedule made. With 6,405 books, 22 accredited journals, 27 international journals, 3 science magazines, 23 proceedings, and more than 40 ebooks and 798 final tasks. Stikes Bethesda Yakum Yogyakarta provides students lounge as a comfortable environment for daily learning and discussion to enhance the students' learning productivity. Stikes Bethesda Yakum Yogyakarta also provide rooms for problem-based learning discussion. The lecturers and the students can actively discuss through their PBL material to build up their knowledge autonomously. Furthermore, along with the dynamic development of information technology, Stikes Bethesda Yakum Yogyakarta has applied online learning method so that students can learn anywhere at any time. Another facility offered for the students is the computer lab and also language lab. Stikes Bethesda Yakum Yogyakarta provides dormitory for female students. A strong referral network with public hospitals, private hospitals, and foundation hospitals has been built for the students' clinical practice placement. Stikes Bethesda Yakum Yogyakarta has some numerous achievements. The students' achievements, both local and international. Stikes Bethesda Yakum Yogyakarta also facilitates the students to develop their interest and talent by having student sport clubs such as futsal club, martial art, basketball, table tennis, chess, badminton, and volleyball club. Students' art clubs such as dancing club, choir, band and acoustic, and traditional music club. To embody the vision of Stikes Bethesda Yakum Yogyakarta, that is to produce healthcare professionals with global competitiveness, the students involve themselves in some international events such as Student Exchange Program, Joint Summer Programs, Operation Pacific Angels, and Intercultural English Program. Stikes Bethesda Yakum Yogyakarta has built a strong network with hospitals and institutions of various fields all over Indonesia. We also continue to collaborate and build synergy with higher education institutions all over Asia Pacific. Through its Career Center, Stikes Bethesda Yakum Yogyakarta provides assistance to students and alumni with planning a career, developing job search strategy, and more. The center also facilitates in-campus recruitment for the students. Within less than 3 months, 95% of the students are recruited, and the rest apply for civil servant and pursue higher education. Our loyal stakeholders are hospitals belong to Yakum and some private hospitals. We are also realizing the need to implement soft skill training to shape the excellence of graduates' quality, such as decision making, shaping inner beauty, service of excellence, how to succeed a job interview, career path, and table manner.
Alasan saya memilih Stikes Bethesda Yakum sebagai tempat menimba ilmu karena saya mendapatkan ilmu yang selalu update tentang keperawatan. Selain itu, saya juga diajarkan tentang tata krama dan perilaku yang baik. Itu adalah modal utama kita saat terjun dan berbaur dengan masyarakat nantinya.
Alasan saya memilih Stikes Bethesda Yakum Yogyakarta dalam menimba ilmu karena Stikes Bethesda Yakum Yogyakarta merupakan institusi pendidikan yang memiliki banyak lahan untuk praktek mahasiswa. Selain itu, Stikes Bethesda Yakum Yogyakarta juga bekerja sama dengan banyak rumah sakit dalam rekrutmen pegawai. Sehingga, lulusan Stikes Bethesda Yakum Yogyakarta cepat dalam mendapatkan pekerjaan. Dan lagi, di Stikes Bethesda Yakum Yogyakarta memiliki banyak peluang beasiswa yang mudah untuk kita peroleh.
Alasan saya memilih Stikes Bethesda Yakum Yogyakarta sebagai tempat menimba ilmu, yaitu kampus ini memiliki segudang prestasi baik akademik maupun non-akademik, dan yang pastinya SDM-nya pun sangat berkualitas. Di Stikes Bethesda Yakum Yogyakarta saya mendapat begitu banyak ilmu yang dapat saya terapkan di keseharian saya. Saya bangga menjadi bagian dari Stikes Bethesda Yakum Yogyakarta.
Alasan saya memilih Stikes Bethesda Yakum Yogyakarta sebagai tempat saya menimba ilmu adalah
dikarenakan visi dan misi dari Stikes Bethesda. Di Stikes Bethesda saya mendapatkan banyak sekali bekal yang saya bawa hingga sampai saat ini saya bekerja, yaitu manajemen time dan peduli penuh kasih. Dan saya sangat bangga sekali menjadi salah satu keluarga dari Stikes Bethesda Yakum Yogyakarta.
Alasan saya memilih Stikes Bethesda sebagai tempat menimba ilmu karena merupakan sekolah keperawatan Yayasan Kristen untuk Umum yang berada di Yogyakarta dan dekat dengan tempat tinggal orang tua saya. Juga memiliki fasilitas rumah sakit sendiri, fasilitas di kampus lengkap, dan juga adanya pengajar-pengajar yang profesional di bidangnya.
Come and join us of becoming an excellent healthcare professional who is caring with love.
Thank you, Mrs. Nurlia Ikaning Tias, SCOP Nurse, MCOP, SPCOP MB, PhD NS for the welcoming speech. Ladies and gentlemen, coming up next is the welcoming speech from Yakum, the Christian Foundation for Public Health. Mrs. Penny Rahayu, MM, the time is yours.
Thank you for the time, Elena. The distinguished speakers, Madam Assistant Professor Dr. Rung Rawe Navicharan, Madam Anunciacion Tita Losik from Philippines. My apologies if there is any mispronounce. Ibu Nurlia Ikaning Tias and Ibu Arsinta Sumarsono from Indonesia. I will also extend a warmest regard to Bapak Tri Prabowo, is the head of Pengurus Wilayah Persatuan Perawat Nasional Indonesia DIY, the management of Stikes Bethesda Yakum, and all the committees of International Seminar and National Core Papers of Stikes Bethesda Yakum Yogyakarta. And of course, all the participants who joined the event online. Very good morning for all of us. And I'm speaking on behalf of Yakum to give a remark on this special occasion, the International Seminar and National Court Papers of Stikes Bethesda Yakum Yogyakarta. First thing first, let's thank God the Almighty for His blessing and guidance so that we all can gather and join this wonderful event. So this seminar today is one effort of Stikes Bethesda Yakum to embody its global vision and so to maintain international networking as well, which means it should be in the belief to enhance Stikes Bethesda Yakum for its global synergy. But at the same time, this agenda also calls for a synergy between the units inside Yakum. As we all understand that Yakum's work of service is not only limited in education sector, but also in health services through our hospitals and clinics, as well as community services through what we call PKMK, or Community Health Development and Humanity Directorate. So overall, it is hoped that Yakum, through all its units, can expand our national and international service network. Therefore, on this occasion, I would like to thank all the speakers, PPNE, the management of Stikes Bethesda Yakum, the participants and all the committees for your positive contribution in the event. Finally, may all the speakers, presenters, and participants can find this meaningful sharing and discussion an enjoyable and rewarding experience. Yakum, serving with heart. Thank you. I give the stage back to Elena.
Mrs. Penny Rahayu, MM, for the welcoming speech. Ladies and gentlemen, the last but not least, I would like to invite Mr. Bondan Palestine SKM MKep SPCOM from Indonesian National Nurses Association PPNI DIY to give his remarks and also to officially open this international seminar. Mr. Bondan Palestine SKM MKep SPCOM, the time is yours.
Okay, thank you, Elena. Good morning, everyone. I respect to all the attendees, especially to the head of Bethesda Yakum Yogyakarta, Mrs. Nurse Nurlia Ikaning Tias, Master of Nursing, Medical Surgical Nursing Specialist, Doctor of Philosophy in Nursing Sciences, and Mrs. Penny Rahayu Pramono. All lecturers at Stikes Bethesda Yakum Yogyakarta, and the organizers of the International Seminar on Community Nursing Services during the COVID-19 pandemic. The Honorable Mrs. Assistant Professor of Nursing Rungarawi Navisharan from Faculty of Nursing Chulalongkorn University, Mrs. Dr. Annunciacion Talosik as the Dean of School of Nursing and Allied Health Sciences, St. Paul University, Philippines, Mrs. Nurse Dr. Nulia Ikaning Tias as Head of Stikes Bethesda Yogyakarta, and Mrs. Asinta Sumarsono SSC MPH as Director Yakum Community Outreach Program Indonesia. On this occasion, allow me to represent Mr. Tribarbo as the Chairman of the Indonesia Nurses Association in Yogyakarta. He is currently at the same time opening the Regional Congress of the And ladies and gentlemen, the COVID-19 pandemic has put health systems under unprecedented pressure, challenging the workforce, especially nurses. The majority of COVID-19 cases occurs at the community level, requiring health services to be available at the primary healthcare level, which also includes community health nursing or THN services. It's important to understand various perspectives of the parties involved, effective solutions, and strategies used by nurses in managing COVID-19 in order to be able to provide these services. 5 themes can be used by policymakers to develop strategies in optimizing the community health nurses in COVID-19 pandemic management and the possible challenges of future global pandemic. They are providing comprehensive services by community health nurses, utilizing the technology to bridge the information needs, implementing family nursing care, spreading the wings of health cadre by community health nurses, and collaborating as the heart of COVID-19 prevention and management. Community health nurses should employ health education, empowerment strategies, group processes, and advocacy to adapt to the COVID-19 pandemic. Ladies and gentlemen, before we begin this seminar, I would like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it a success. This event would have been impossible without the support of each and everyone present here. Seminar are organized and conducted for the nurses to gain insight and information that will remain effective in their work. I ensure this seminar will be profitable and fruitful for everyone present here. And now let's begin this international seminar and national call for people community nursing services during the COVID-19 pandemic that presented by Stikes Bethesda Yakum Yogyakarta and Commissariat Board of the Indonesian Nurses Association at Stikes Bethesda Yakum Yogyakarta. Good morning and thank you everyone. God bless you.
Thank you, Mr. Bondan Palestine SKM MKEP SPCOM for the welcoming speech. Ladies and gentlemen, now we come to main agenda of this international seminar. To lead the discussion, let me invite a friend of mine, Kidung Madah Gusti, as a moderator. Okay, Kidung, are you ready?
Yes, I'm always ready, Elena.
You may lead the discussion.
Thank you, Elena. Good morning, everyone. My name is Kidung Madah Gusti, and I will be the moderator in this international seminar entitled Community Nursing Services During the COVID-19 Pandemic. First of all, let me inform you that today's seminar will be a plenary session. A session for discussion or question-answer session will be done after the plenary session. If you have any question, you may also type down your question in the chat box with the following format: your name, _country, _speaker, _question. Now, let's start the first session. In the first session, we are going to have Assistant Professor Dr. Rungrawi Navicharin from Chulalongkorn University, Bangkok, Thailand. Good morning, Dr. Rungrawi. Can you hear my voice?
Good morning. I can hear your voice. It's completely, very smoothly.
Okay, thank you,
Can you
Dr.
hear my
Rungrawi.
voice? Okay. Can you hear my voice?
Yeah, we can hear you. Okay. Thank you, Dr. Rungrawi. It's an honor for us to have you here in this seminar. In this session, Dr. Rungrawi will be given 45 minutes to deliver her presentation. I will give notification 10 minutes before the allocated time ends. And in this seminar, Dr. Rungrawi will be presenting about barriers to community nurses in dealing with the increase in COVID-19 cases in the community. Before we start, let me read the CV of our keynote speaker. Assistant Professor Dr. Rungrawi Navicharin. Currently, she is the Assistant Professor of Chulalongkorn University. She got her Master degree of Nursing Science from Mahidol University, Bangkok, Thailand, and her doctoral degree is from Chulalongkorn University, Bangkok, Thailand. Her research interests range from chronic illness and specialty of diabetes, perioperative surgical care, and COVID-19 caring. Now, without further ado, let's welcome Dr. Rungrawi. Dr. Rungrawi, the time is yours.
Thank you very much to invite me to join this international seminar. First of all, good morning, everybody. I would like to present my topic is Can I share my slide?
Yes, it's already appeared in the screen, Dr. Rungrawi.
This is okay.
Perfectly okay.
everybody can see my slide. Okay. Thank you very much, Dean, and all your team that invite me to join this seminar and assign me to have you an experience and sharing about the topic and investigation related to barriers to community nurse in dealing with increasing COVID-19 case in the community. I would like to present some of clip video that show the successful in dealing with COVID-19 from the WHO. Could the team help me to show the clip video?
Okay, Dr. Rungrawi, could you please stop to share the
Stop,
screen, please?
stop share. Yes, I stop sharing.
Okay.
It's so much easier to fight an epidemic like COVID-19 when you have a strong underlying health system. Thailand has spent 40 years committing itself to and investing in its public health infrastructure. This is really where the rubber hits the road in a pandemic.
Thailand has experienced several outbreaks of very large scale, starting from SARS back in 2003. Those taught us lessons, make us prepare for the big pandemic. We started our implementation of WHO IHR capacity in 2006-2007 and also improve our public health emergency management. In early March, we start to see a rapid increasing of local transmission. The number of new cases gradually reduced through April and May.
This is something that WHO emphasizes to countries again and again. The need to be able to identify cases, isolate and treat them, and quarantine and trace contacts is so important.
คิดก็ตอนแรกก็ไม่ได้คิดอะไรเท่าไหร่แต่พอรู้ว่ามันรุนแรงก็เริ่มตกใจนะคะเริ่มตกใจกันมากเลยนะคะเราทำอย่างไรที่จะช่วยชุมชนเรานะคะโดยเริ่มต้นจากในบ้านเราก่อน
The village health volunteers are ordinary people who devoted themselves to take care of their friends or family within their village. The strength of the village health volunteers has contributed significantly for the Thai government to keep things under control.
จะมีเชื้อโรคไหมอะไรอย่างนี้ครับผมกักตัวเสร็จแล้วผมก็โทรปรึกษาตลอดปรึกษาหมอตลอดครับผมถ้าว่าอาการอย่างนั้นอย่างนี้ปวดเมื่อยกล้ามตัวอะไรอย่างเงี้ย
ก่อนหน้านี้มีเพื่อนเป็นอสต.ที่โรงพยาบาลเขาชักชวนให้มาเป็นอสต.แล้วก็อยู่ไปอยู่มาก็เขาก็ไปเยี่ยมบ้านตามเข้าไปทุกวันก็สนใจในด้านนี้ก็เพราะว่าเราก็จะได้มีความรู้แล้วก็มีสุขภาพที่ดีแล้วก็ชาวเมียนมาด้วยกันจะได้มีสุขภาพที่ดีคิดอย่างนี้ก็เลยมาเป็นอสต.ค่ะ
village health volunteers and the migrant health volunteers. They are really the eyes and ears of the health system in the community. I think it's really this trust between the community and the public health system. It's doctors, it's nurses, it's allied health professionals, and it's village volunteers that makes this whole system run so effectively.
I think one of the very good reasons that we can manage COVID-19 very well was that if you look at Thai cultures, whenever we have crisis, the Thai will unite.
Dr. Rung Rawi, your microphone is still mute.
Okay. Thank you very much, the team.
Okay, Dr. Rawi, excuse me. Would you do you want to share your screen by yourself, or should we help you?
I thought the team can help me to share my slide. Okay.
Okay.
Okay. Okay. Next, please. After we see the clip video, you can see that Thailand has successful for dealing with COVID-19 that can help from the WHO and develop that clip to show our competency for dealing with COVID-19 in community by assist from health volunteers. Next slide, please. From the prevalence of COVID-19 in Thailand, you can see a lot of pandemic disease, and it occur in Bangkok and other provinces during 15 March to 4 July. This is the earlier phase that we have to coping and try to solve the problem during the time, and it can impact in urban country, especially Bangkok, and in rural area. Next slide, please. And can you show and place this clip? And I would like to show the incident and prevalence between earlier phase and now. The team can place this clip.
Okay, we are currently processing the link.
Okay, this link can you sliding in Thailand from January 2000 now. We can see the data. Can you slide down? The cumulative of the new case and the death rate and the new case that involve and receive the vaccine and incident of infected COVID-19. We can show that, can you sliding a little bit above? Okay, it have some problems that, okay. The next slide is I would like to show the Thai healthcare system in the community and in the urban area, we have divided in the 4 areas: village, sub-district, district, and province. In each area, we can relate it to the Thai healthcare system. At the bottom, we link to the self-care, and the next is the primary healthcare hospital, secondary care hospital, and tertiary care hospital, and excellence center. The community nurse have to work, encourage people to self-care on themselves. Anyway, we provide service in the primary health care, and the community nurse work in this area. In some area of Bangkok, the nurse has provide in the staff nurse in 5 nurses in each health center. But in the rural area, there is only 1 or 2 nurses in the staff of Ministry of Public Health. And when the patients got illness or severity, the community nurse have to send them or refer them to the further such as primary care hospital or secondary care hospital or tertiary care hospital. This can impact all of the work and task force of the community nurse, because there are a lot of tasks that develop barriers in community during COVID-19. Next slide, please. I would like to show the routine nurse. The routine nurse before pandemic COVID-19. The nurse in our country in rural area have 4 roles. The first is curative treatment or curative management. The second is health promotion. The third is health prevention, and the fourth is rehabilitation. For the tasks or working in the part of curative treatment, in the morning, we deliver the service of chronic illness in the morning, such as we checking vital signs, administering injection, assisting doctor with examination and medical procedures. For the part of health promotion, we set up in the early as well, and we divided the team to help the well-being clinic and vaccine and promote elderly well-being. In the part of health prevention, we have to go to the community in the morning or in the afternoon, try to screening the population in the community for early prevention disease such as diabetes or and hypertension or other areas of the illness related to chronic disease. In the part of rehabilitation, the nurse in the community assists the patient who discharged from the hospital by encouraging and improving physical and psychological domain. Not only in the 4 roles, but we have other tasks such as coordinator, collaborator, facilitator, or change agent, teacher or supervisor, consultant, researcher, and research result applicator. Finally, the manager in disease control and prevention. This is the situation of the role and working of community nurse before pandemic COVID-19 in Thailand. Next slide, please. I would like to show the picture that the nurse had got the normal dress and gave the way to daily health service. For example, the screening for finding the patients who have risk for NCD, teaching health education, and giving some medication. You can see the nurse did not get the suit such PPE or did not cover with the mask on the face. Next slide, please. The part of rehabilitation in home care that we try to improve the physical and psychological of the patient related to the disability or elderly. Improving rehabilitation, we try to provide physical rehabilitation or other well-baby clinic to promote the children at home to develop the relationship between mother and their child. And we develop the nutrition management by feeding tube insertion, excretion management such as carrying urinary catheter and evacuate feces, and other parts such wound care as well. They have not provided social distance for health service and no mask on the face as well. Next slide, please. After the COVID-19 has impact on our country, we found that there are many barriers to community occur both in Bangkok and rural areas in our country. Next slide, please. The situation of the role and working of community nurse during pandemic COVID-19. From the part of curative treatment, we have to stop delivery of the service related to chronic disease. We cannot manage face-to-face to the patients, so we have to change the delivery treatment via telemedicine. The management had to provide via home isolation and community isolation. In the part health promotion, the nurse community have to stop the service in the well-baby clinic and elderly well-being. In the part of health prevention, we have to stop routine screening of the population in NCD, but we have to change the screening into find out the risk people or high-risk people or patients who have severe with COVID-19. In the part of rehabilitation, the nurse have to stop visiting and assist the patient at home, and we have to encourage and coach the caregivers to do the rehabilitation via telemedicine. And other tasks, we have to focus on COVID-19 such coordinator between setting and another setting, collaborator among health providers between setting, and facilitator and change agent and manager in disease control and prevention, and improving and sharing team to administer vaccination at Bang Sue Central Railway Station in Bangkok. This is, you can see, is all our, next slide please. This is all our changing during COVID-19. In barriers to community nurse, we have I have to interview the nurse, head nurse in community nurse and ask them the question, what were the barriers to community nurse in dealing with increasing COVID-19 which you met? Next slide, please. The summarize of the content that I show you. It can divide it into two parts. The first is the teamwork and the second is organizational. In the teamwork, they said that they all had high workload and burnout, and due to lack of staff, the lack of knowledge and experience to practice to deal with the COVID-19, and they limit to communication with patients at home and community isolation. In the barrier of the part of organization, the lack of organization supports in all over the rural area and in Bangkok, and poor organizational communication and inadequate infrastructure. This is all the summary. They tell me about the high workload and burnout, and due to lack of staff. One of the head nurse at the health center said that each public health center has just only one or two nurses. They may have many tasks that have to run, such as managing curative treatment via telemedicine, screening the least people, delivering healthcare service through home and community isolation, prescribing medicine, collaborating and referring some patients who had the severity of COVID-19. They had hard work and not enough sleep, as well as they got fatigue. Some of them had to share team to administer vaccine at Bang Sue Central Railway Station. Next slide, please. In the rural area, and they have to visit the patient at home. They provide curative management via home isolation and community isolation. Visiting a patient who had home and getting dressed with PPE and send them to management and service, and send some pharmaceutical and drug for patients at home, involving in preparing community isolation for families members who were infected COVID-19. Next slide, please. During visit at home, they have to provide logistic route. They have to send some food and collaborating the logistic and sending food to patients with home isolation and community. You can see the PPE suits that not provide for them. They have to use the raincoat for prevent COVID-19 from the infected patients. Next slide, please. This is the slide to show a lot of patients and risk people waiting for screening at on-site of each public health center or health center in Bangkok. Even though they provide daily service to Thai people, they still service to the foreigner, such as Myanmar migrants, screen and for COVID-19 spike in Thailand. The community nurse at Tak province, they have to perform RT-PCR for them. Next slide, please. This situation, I would like to show you, they have to share and involve the team to administer an injection of COVID vaccination at Bang Sue. The queue and a lot of people to wait for vaccination. The team have to sharing on public health center both in Bangkok and rural area. They try to share each of them, and one of the nurse, they come to Bangsar railway station 2 or 3 times a month, and they go back to do the perform prevention and curative management for patient infected COVID-19. This is very work hard. Next slide, please. When they lack of knowledge and practice, they said, I and my staff nurse felt difficult to give information related to preventing COVID-19 and to consult them related to medicine which the physician prescribed it. They said we had to use our mobile phone to contact the patients with COVID-19. The patient asks any question, we have to seek help information from the Google. The Google is the teacher. At the early phase, there were no the guideline for curative management in the community. We had to know a little bit of herb to treat the patient with COVID-19. At that time, there are many herbs to use and prescribe to the patients who risk or are high risk of get infected already, but the knowledge of the herbs quite a little bit. Next slide, please. After the communication has problem, the Public Health Ministry tried to collaborate with the IT Center of the Thailand. They developed the application to have communication and treat between home and community isolation for families members who were infected COVID-19 via telemedicine such AMED program and application. The nurse in community had to work this application. Next slide, please. This is the application. When the patient register via that application, they send the detail and data to the community nurse. They have to interpret and respond to the patients who got risk and infected, and try to respond and give the information such the self-care and reduce the severity of the disease to the patients. Next slide, please. They have to develop infographic to the patient with home isolation, and after the patient got severity, they refer the patient with COVID-19 to the emergency room hospital, but they have to wait for outside because they will not provide admission to them, to the patients. Next slide, please. That is the barrier I show you. There are a lot of barriers among Bangkok and rural country. Anyway, after the post-COVID-19, some barriers have solved already and some barriers still go on, but we have to adapt and we have to solve the problem, some our own area and some from the organization that try to help us. We have a lot of budget and some health volunteer, both professional health volunteer and health volunteer in community that make us successful in dealing with COVID-19. After the COVID-19 pandemic has gone, is called post-pandemic COVID-19 in the era. The change of the community that change our tasks and experience, we have to come back to do the provide service to the patients again. But the new normal has come to our community and our patients and our Thai population. We still go on daily curative treatment, health promotion, health prevention, and rehabilitation. We can deliver the service chronic disease, and we have to examination and work on the patient with COVID-19. We still go on well baby clinic and elderly well-being. And in the part of health prevention, we still screening population in the NCD disease and is including infected COVID-19 patients. We still go on to assist the patient who discharge from the hospital by encourage and improving physical and psychological domain, and still via telemedicine in some parts of area. We still go on other tasks, coordinator, collaborator, facilitator, exchange agent, teacher, or supervised consultant and research. New normal has come, and we have to accept that new normal. Next slide, please. In the current time, you can see we still have not enough for PPE suit. In the community, we have to buy some raincoat and the mask on our face, and deliver vaccine at home for elderly who stay at home. We have to take the elderly patients from community in each home, and we have to visit them at home to provide vaccination to them. Next slide, please. In the current time, the successful that we during the COVID-19, the screening is still go on for non-communication disease by collaborative to healthcare volunteer. This is all the big experience of our dealing with COVID-19. And barrier another in some part of the making the problem still go on. Next slide, please. Okay, that from the experience of the nurse in Thailand, but I would like to support my idea and the community nurse. I found the literature review to support those barriers. Erika Buskai et al. They study barriers and facilitated to the implementation of nurse role in primary care setting, and show the summaries of the result that support our idea. Next slide, please. This method is the integrative review and conduct at the Medline and CNOW database until 9 June 2000. The qualitative, quantitative, and mixed method research study was selected to identify for the extract of the result, the consolidating framework for research implementation to identify the factors that influence implementation in healthcare in community. Next slide, please. The results show that following the duplicate removal, the source identified, and the selected study were conducted in 13 countries. Most of them is the Oceania, Europe, North America, Latin America, and the Caribbean. This result can support our Thailand community. It is the same of the barrier that found together. Next slide, please. These results show that the nursing professionals' regulatory and regulatory aspect within the context of care, cultural and organizational aspect, training and the transfer of specific skills, which were previously designated to doctors. Next slide, please. The barriers that show in summaries the nurse part to 4 main factors affecting nurse role implementation. 1. They said that and summarized that the problem and the barrier is the scope of practice, lack of nursing guideline and regulation for working. This is the same as in the earlier phase in Thailand. Nursing workload is the high working loading and the nursing education that to stop and the change curriculum to the new normal and the lack of funding, lack of budget by to buy equipment and PEE suit and another instrument for seeking and prevention and curative treatment. This result consistent to the interviewing that came from Thai community nurse. Next slide, please. During pandemic 19, because I was assigned to sharing experience as only barriers, I would like to conclude that during the pandemic, the community nurse in Thailand had a lot of barriers to provide service care, and they have to adapt themselves for assisting the patients with COVID-19. They need to develop attitude and skill for a variety of tasks. This is all that inclusion and conclusion that I would like to share the experience to you of all. Thank you very much. Thank you for your attention.
Okay, thank you, Dr. Rungrawi, for the sharing that is full of insight. We still have 5 minutes more. Do you have any words before we end your material?
Any question?
Okay, we will have the question and answer session later after all the speakers already present the material. Okay. Thank you,
Thank you.
once again, Dr. Rungrawi, for your sharing. That is really insightful for us.
Thank you very much.
Yes, and I'm reminding all the participants, if you have any question, you may type down your question in the chat box in the following format: your name _ country _ speaker _ question. Now we are going to continue to the next session. In this session, actually we are going to have a presentation from Mrs. Anunciacion Titalosik DNS from St. Paul University, Philippines. Unfortunately, due to her health issue, she cannot join us this morning. Therefore, we are sorry about this and wish for a speedy recovery for Mrs. Anunciacion. Now, without waiting for any further, we come to the next session. In this session, we will have Mrs. Nurlia Ikaning Tias, S-Cup Nurse, M-Cup, SP-Cup, MB, PhD, NS from Bethesda Yakum Institute of Health Sciences, Yogyakarta, Indonesia. Good morning, Mrs. Nurlia.
Good morning.
Okay. Can you hear clearly my voice?
Yes, I can hear your voice.
Okay.
All right, because
could you please turn on the camera, Mrs. Nurlia?
yes, waiting because the device cannot support.
Okay. Okay.
Thank you for your time.
Okay, it's a pleasure to have you in the seminar, Mrs. Nurlia. This morning, Mrs. Nurlia will be presenting about implementation, testing, tracing, and treaty by community nurses during the COVID-19 pandemic. And also, we will have a sharing session from Mrs. Arshinta Sumarsono, SSE MPH from Yakum, the Christian Foundation for Public Health, Yogyakarta, Indonesia. Good morning, Mrs. Arshinta. Can you hear my voice?
Clear and sound.
Okay,
Thank
thank
you,
you.
Mbak Kidung. Yes.
Okay, ladies and gentlemen, before we start, let me read Mrs. Nurlia's CVs. Mrs. Nurlia Ikaning Tias, S-Cup Nurse, M-Cup, SP-Cup, MB, PhD, NS. Currently, she is the head of Bethesda Yakum Institute of Health Sciences. She got her master degree of nursing science from Universitas Indonesia, and her doctoral degree is from St. Paul University, Philippines. Her research interests range from palliative care nursing and HIV/AIDS nursing. Okay, Mrs. Nurlia, you have 20 minutes to deliver your presentation. I will give notification 10 minutes before the allocated time ends. Mrs. Nurlia, the time is yours.
Thank you so much, Kidung. Good morning, everyone. And thank you, and the committee can share my slide. Thank you. Today, I would like to present implementation of testing, tracing, and treatment by community nurses during the COVID-19 pandemic. But I'm not alone because I have a friend. My friend is Mrs. Arsita. She always accompanied me during the pandemic. She is a director of Yakum Health Community Services. So other than that, Mrs. Arsita will share her experiences during the pandemic. Okay, next slide. This is the presentation outline, not long, it's just simple. The first definition, the rules of nursing, and learn from the pandemic. So slide, okay. This is about testing and then tracing and treatment. So maybe the pandemic already gone, but we can learn about how to face the pandemic. It's possible that there will be a pandemic in the future. The Indonesian government has a policy on tracing, testing, and treatment. So this is about the policy. Testing a high positivity rate, more than 5% reflect with transmission, and lack of testing ratio of 1 per 1,000 per week must be achieved. Slide. Tracing, puskesmas or health services center officer immediately conduct close contact tracing after getting the result of the examination of confirmed cases or probable cases, in addition to contact tracing COVID-19 cases finding. To reduce transmission rates, close contact must be defined quickly. Target close contact should be at least 15 people per case. Confirmation identified within 72 hours. The next slide, treatment. Bar or bed occupancy rate, so the hospital readiness to handle moderate and severe cases bar below 70% indicates adequate capacity. This is indication about it. Okay, the next slide. One of the efforts to strengthen testing, tracing, treatment is with the enforcement of restriction on micro-based community activities in Indonesia called PPKM Micro, which focuses on effort to control the smallest levels in the village. PPKM Micro carried out through coordination between all elements involved, starting from the head of the RT or RW, the head of the village, the community protection or Sanlitmas on Babinsa, also police, also the Babinkatibmas. And then we also collaborate with Dasawisma, PKK, local leaders, youth leader acceptance workers, health worker, and youth organization, and other volunteers. So many collaboration in the community. The village is an organization that applies a very important role, important as a forum for community, and then understanding require and good and correct implementation by all elements of the COVID-19 command post in performing 4 functions. Namely, the prevention function includes socialization of regional mapping, mobility restriction. Handling function include health, economic, social. The coaching function include the enforcement of protocol, discipline, health, giving appreciation and sanction. Support function include like recording and reporting support. And also they provide logistic, administrative, and communication support. Each village will be assessed for the risk of transmission. Control will be determined based on zoning. So in Indonesia, we have like a zoning, green zone and yellow zone or something like this. In a situation where there is a spike in COVID-19 cases, Puskesmas need to immediately increase the capacity of testing, tracing, also quarantine or isolation. Inspection, tracing, quarantine, and isolation is a continuous process of a series of activities which be successfully if done quickly and disciplined. Process this require community involved in the implementation and coordination with government unit, including Puskesmas, Department of Health, also police, sub-district, and head of village, and cadres, and volunteer also. So we can see that testing, tracing, and treatment have many collaboration. Previous slide. Yes. So testing, tracing, and treatment have many collaboration. This is a healthcare worker, and then healthcare worker go to the community, have many collaboration in the community, and how to the nurses role. Nurses have a role as a healthcare worker. Also, nurses has a role in the community to empowering community about tracing, also about testing, something like this. So in Indonesia, if we have a mild symptom, we can get independent isolation or self-isolation. So not have to go to the shelter, but we can isolation at home. So the next. This is, I have researched research in 2020. This research was conducted in 5 districts in DIY province. Respondents in this study were 477 respondents. Now we can see that the community participation in the testing, they have strong agree. This is 50. Oh, sorry, it's not clear. This is 33%, and then agree for 53%. So we can see that community, they want to participate in the implementing testing, tracing, and treatment. In the next figure, community participation in tracing. So this is also the community want to participate to tracing, for tracing. This is we can see that strong agree 52%, and then strong agree 40%, and the agree 52%. And then self-isolation at risk, and the community said that they afraid that they will self-isolation at home. This is a community participant in self-isolation, but they are afraid to get a self-isolation. But in the next figure, they want to participate to self-isolation at home. So the next slide. Yes, this is a research also. I have research also. Many people don't want to be tested because of stigma. So stigma is the problem in the pandemic. This is important. So we can learn about the next pandemic, maybe can be. We can manage about stigma. Social stigma in the context of health is the negative association between a person or group of people who share certain characteristics and specific disease. In an outbreak, this may mean people are liable to stereotype, discrimination against, treated separately, and or experience lost status because of a perceived link with a disease. Such treatment can negatively affect those with the disease, as well as their caregiver, family, friends, and communities. People who a stigma. The current COVID-19 outbreak has provoked social stigma and discriminatory behavior against people or certain ethnic background, as well as anyone perceived to have been in contact with the virus. This will be an obstacle in the implementation of testing, tracing, and treatment because they will be high in the disease. It's mean testing and then tracing and treatment cannot be implemented. That's a problem when we implementing about testing, tracing, and treatment. Okay, I just have 5 minutes again. Maybe the next slide. This is a community rules. Coordinate contact tracing with Puskesmas and task force, keeping track on close contact, document tracing, identify high-risk contact, identify symptom contact, manipulating social restriction, organizing isoman or independent isolation or self-isolation facility, reporting to the health center, assist in future tracking of puskesmas and monitoring resident self-isolation. And then the end of my presentation, I would like to share about how to we implementing about testing, tracing, and treatment with telemedicine. We can share it with video, maybe in the comment we can share.
Selamat pagi Mbak Reni.
Selamat pagi Pak.
Bagaimana pagi ini?
Sudah agak lumayan Pak.
Ya, gimana dengan keluhan kemarin ada batuk, sesak nafas sudah berkurang atau sudah hilang pagi ini?
Sudah lumayan berkurang.
Nah, sudah baik ya. Baik Mbak Reni. Jadi dari hasil visit dokter pagi ini, pemeriksaan dokter pagi ini, walaupun mungkin belum sembuh total, tetapi kondisi Mbak Reni saat ini sudah memungkinkan untuk rawat jalan, jadi sudah diperbolehkan pulang dan nanti tetap walaupun sudah pulang tetap harus melakukan isolasi mandiri. Begitu gimana ini?
Baik Pak.
Ya, jadi untuk tindak lanjut dari perawatan di rumah, walaupun nanti di rumah, nanti kami tetap akan melakukan pemantauan ya setiap harinya sampai batas waktu isolasi mandirinya selesai. Ya, jadi nanti di Bethesda dan Dekum ada program yang namanya Bethesda Yakum Care Center ya. Jadi nanti Mbak Reni akan mohon bisa mengisi link yang ada di situ untuk registrasi di tempat kami sehingga kami nanti setiap hari akan bisa memantau kondisi Mbak saat di rumah dan saat melakukan isolasi mandiri. Apakah ada yang ditanyakan Mbak Reni?
Linknya Pak?
Ya, baik. Linknya sudah saya kirimkan ke nomor Mbak Reni ya untuk linknya ya.
Sudah masuk Pak.
Sudah masuk ya. Oke, baik. Jadi nanti di situ kalau dibuka nanti ada 3 hal yang ada di situ ya. Jadi yang pertama nanti ada registrasi ya. Kemudian di situ nanti ada pemantauannya di situ. Jadi nanti yang penting pertama adalah melakukan registrasi dulu ya. Nanti setelah registrasi nanti Mbak akan dihubungi oleh call center kami untuk kemudian melanjutkan pemantauan setiap harinya. Ya, gitu nggih. Apakah kira-kira begitu? Bisa gampang ya nanti ya untuk dilanjutkan ya.
Baik Pak.
Oke, baik. Kalau tidak ada pertanyaan, ya semoga lekas sembuh, menjadi sehat kembali dan selama masa isolasi mandiri yang ditetapkan ya nanti dikasih tahu juga sampai kapan untuk isolasi mandirinya. Tetap kalau misalkan terpaksa ketemu dengan orang tetap harus menerapkan 3M ya. Ya. Oke, demikian saja. Oke.
Baik Pak, terima kasih Pak.
Ya, sama-sama. Semoga lekas baikan.
Ya, terima kasih Pak.
Oh, ada data yang masuk. Saya akan segera mengirim data ini ke call center Bethesda Yakum Care Center.
Halo, selamat siang, Bethesda Yakum Care Center.
Halo, selamat siang Bapak. Perkenalkan, saya Reni, Pak.
Oke, baik, terima kasih Bu Reni. Saya Isnanto yang dinas pagi hari ini. Ini adalah nomor WA yang kemarin diisikan lewat link observasi kami ya Bu ya?
Benar sekali Bapak.
Baik, ya. Bu Reni, terima kasih untuk kesediaannya mengisi dan memberikan informasi tentang data pribadi Ibu. Kami turut berdoa untuk kesembuhan Ibu. Selamat siang, salam sehat selalu.
Selamat siang Pak, terima kasih Pak.
Baik.
Halo, selamat siang Pak Muji.
Selamat siang Pak Isnanto, ada yang bisa dibantu Pak Is?
Iya Pak, ini kami dari Bethesda Yakum Care Center sedang melakukan pemantauan terhadap salah satu pasien yang Covid-19 dan mereka membutuhkan layanan telemedicine, Pak.
Oke, baik Pak Is. Apakah nomor pasien tersebut bisa dikirimkan ke saya Pak Is supaya nanti bisa saya telepon?
Iya Pak, baik. Akan segera saya kirimkan via WhatsApp ke nomor Bapak yang ini ya. Nanti mohon kesediaannya untuk menghubungi karena pasiennya sudah menunggu, Pak.
Oke, baik Pak Is. Siap, kami siap membantu Pak Is.
Baik Pak Muji, terima kasih Pak. Saya kirim segera ya. Selamat siang.
Sama-sama Pak Is. Terima kasih.
Halo, selamat siang.
Selamat siang. Benar bicara dengan Mbak Reni?
Iya, benar.
Oh, baik Mbak Reni. Perkenalkan, nama saya Mujira Harjo. Saya dari Bethesda Yakum Care Center. Tadi mendapatkan informasi bahwa Mbak Reni membutuhkan layanan untuk pengobatan terkait dengan COVID. Apakah demikian Mbak Reni?
Benar, Bapak.
Oke, baik. Apa yang bisa kami bantu Mbak Reni?
Begini Bapak, saya sedikit flu, kemudian obat saya sudah hampir habis. Kira-kira bagaimana ya Pak?
Oke, baik. Jadi nanti prosedurnya bisa saya sampaikan ya Mbak Reni. Jadi nanti dari nomor yang sudah ada di tempat kami, nanti akan kami sampaikan ke bagian administrasi di bagian klinik Agatha, di bagian telemedicine, dan Mbak Reni nanti akan dihubungi. Setelah itu nanti ada beberapa proses yang akan dilalui, seperti nanti ada pembayaran juga bisa melalui transfer. Kemudian selanjutnya setelah ada bukti transfer, nanti akan dilakukan telemedicine melalui video call oleh dokter kami. Nah, nanti setelah dokter kami melakukan pemeriksaan dan berikan pengobatan, akan melakukan persepan obat ke bagian farmasi. Ya, jadi nanti bagian farmasi yang selanjutnya akan menyiapkan obat-obatan yang diperlukan sesuai dengan resep tadi dan akan memberikan informasi ke Mbak Reni untuk selanjutnya bisa obat tersebut nanti bisa dibantu dikirimkan melalui GoSend. Apakah bisa diterima informasi ini Mbak Reni?
Bisa Pak, berarti nanti saya tidak perlu ke sana ya Pak?
Iya, betul. Jadi Mbak Reni tidak perlu datang ke rumah sakit. Jadi nanti kami bisa melakukan telemedicine ini secara online. Jadi nanti bisa juga Mbak Reni menyampaikan keluhan-keluhan yang Mbak Reni rasakan langsung saat video call tersebut.
Baik Pak, terima kasih Pak untuk informasinya Pak.
Oke, baik. Terima kasih Mbak Reni. Nanti supaya bisa lancar, nanti mohon HP tetap on. Dan terima kasih Mbak Reni sudah mengakses layanan Bethesda Yakum Care Center. Terima kasih Mbak Reni. Selamat siang.
Selamat pagi, Bethesda Yakum Care Center. Dengan Isnanto, ada yang bisa dibantu?
Selamat pagi Pak Isnanto.
Iya, selamat pagi.
Benar, apakah benar ini yang tempat tanya-tanya untuk tentang COVID itu ya Pak?
Benar Ibu, kami membuka layanan Bethesda Yakum Care Center. Kalau boleh tahu dengan siapa saya berbicara saat ini Ibu?
Nama saya Riris Pak.
Oke, baik. Terima kasih Bu Riris. Ada yang bisa dibantu Bu Riris?
Pak Isnanto, saya itu agak bingung nih. Kan ini kan kasusnya di berita itu COVID itu kan meningkat ya Pak.
Iya,
nah,
benar
ini
sekali.
Saya kok ada gejala-gejala batuk-batuk gitu Pak. Nah ini saya itu COVID enggak ya Pak ya? Jangan-jangan nanti saya COVID gitu loh Pak.
Baik ya Ibu, terima kasih untuk informasinya dan kesediaannya untuk sharing bersama kami. Namun untuk mendiagnosis Ibu mengalami COVID atau tidak, kita perlu lakukan pemeriksaan seutuhnya ya Bu ya.
Oh iya.
Oke.
Iya.
Kalau boleh tahu nomor yang Ibu gunakan ini apakah ada koneksi WhatsApp Messenger?
Ada Pak.
Baik. Ya, Ibu mohon izin jika Ibu berkenan, kami akan mengirimkan link assessment untuk COVID-19. Jadi Ibu nanti
Oke.
bisa melengkapinya di link itu. Setelah itu kami akan mencoba menganalisisnya dan jika Ibu berkenan kami akan hubungi Ibu kembali.
Oh iya Pak, boleh biar nanti saya tahu saya COVID apa enggak gitu ya Pak. Oh iya Pak, saya tunggu ya Pak WhatsApp-nya ya Pak.
Oke, baik. Terima kasih Bu Kiki sudah bersedia menghubungi layanan kami. Senang bisa berbagi informasi dengan Ibu. Saya akan segera kirimkan. Selamat siang. Salam sehat selalu. Baik Ibu. Halo, selamat siang. Bethesda Yakum Care Center.
Oh iya Pak, ini Bethesda ya?
Iya Mas,
Saya mau
benar.
tanya,
Oke.
saya mau tanya ini kan 3 hari terakhir kan badan saya
Bapak,
kan nggak enak.
selamat siang.
Gimana? Ya,
Kalau
ya.
boleh tahu dengan siapa saya berbicara?
Oh saya Denny Pak, Pak Denny.
Oke, terima kasih Pak Denny sudah bersedia menghubungi layanan kami. Ada yang bisa saya bantu Bapak?
Oh iya, ini kan saya di pengungsian.
Oke.
3 hari ini kok saya agak demam terus nggak enak badan ini batuk-batuk gitu Pak.
Oke.
Kata teman-teman di pengungsian ini COVID terus saya harus menyingkir gitu, gimana ya Pak ya?
Oke. Kalau kondisinya sekarang batuk pilek, batuk panas ya Pak ya?
Iya ini batuk-batuk terus ya, batuk kering ini.
Iya. Apakah pernah dilakukan pengukuran suhu tubuh Pak?
Oh 3 hari lalu waktu datang ke pengungsian itu diperiksa tapi nggak apa-apa, tapi 3 hari ini kok semakin nggak enak badannya gitu.
Oke, baik Pak. Terima kasih untuk informasi yang sudah dibagikan. Jadi untuk memastikan Bapak positif COVID-19 atau bukan, kami tidak bisa saat ini untuk memastikannya ya Pak ya. Namun jika Bapak berkenan, kami akan kirimkan untuk link observasi supaya nanti kita bisa lihat resikonya seperti apa. Apakah memang beresiko tinggi untuk COVID-19 atau tidak. Kira-kira apakah Pak Denny bersedia kalau kami kirimkan linknya? Pak Denny posisi sekarang di mana Pak?
Ini di pengungsian Glagaharjo.
Oh Glagaharjo, nih Pak.
Iya.
Jadi kemarin kami koordinasi dengan Kepala Posko Pengungsian Glagaharjo, Pak Denny bisa kontak dengan beliau karena di sana ada fasilitas untuk isolasi mandiri Pak. Jadi ada satu ruangan tersendiri Pak yang sudah kami siapkan di sana. Kalau Pak Denny kesulitan, kami bisa bantu untuk menghubungi koordinator lapangan di pengungsian. Oke?
Oh iya.
Ya Pak, supaya hemat waktunya, Pak Denny bisa langsung mengisi link yang sudah saya kirimkan. Nanti akan kami hubungi kembali ya Pak ya, terkait hasilnya. Dan saya akan bantu untuk kontak dengan pihak koordinator pengungsi di Glagaharjo. Begitu Pak Denny?
Oh iya Pak. Kalau masih bingung nanti saya telepon ini lagi boleh ya?
Boleh Pak, sangat boleh. Ya kami buka di layanan ini mulai jam 8 sampai jam 4 sore ya Pak ya. Sekali lagi terima kasih Pak Denny sudah bersedia menghubungi layanan kami. Semoga kondisinya membaik dan sehat selalu untuk kita semua. Selamat siang Pak Denny.
Ya, selamat siang.
Terima kasih.
Cuma memang itu membutuhkan partisipasi aktif sampai ke level paling kecil, RT RW. Nah itu PR beliau ke kita. Jadi saya berjanji ke beliau akan cepat sambil jalanin vaksinasi. Nanti saya ngomong nih sama teman-teman rumah sakit supaya bisa memberdayakan puskesmas, supaya bisa memberdayakan kepala desa atau kecamatan, kelurahan, RT dan RW, supaya kalau ada yang kena, intinya kan gini. Intinya mengatasi pandemi ini cuma satu kan, yaitu mengurangi laju penularan, flattening the curve. Itu banyak kali yang udah di WA group keluar. Nah caranya seperti apa? Kalau kita nemu orang, dia harus diisolasi supaya tidak menularkan.
Thank you for your attention. Hidu, maybe you can continue the next session. I have done. Thank you.
Okay, thank you, Mrs. Nurlia, for the presentation. We will have the question and answer discussion after all the speaker present all the material. Now, the sharing session from Mrs. Arshinta. Before we start, let me read Mrs. Arshinta's CVs. Mrs. Arshinta Sumarsono, SSI MPH. She is the Director of Yakum Development and Humanitarian Programs. Her expertise is in disaster management, organizational and project management, NGO capacity building, grant management, disability inclusion, community organizing, philanthropy management. In the humanitarian section, she was the first batch of trained incident command system in Indonesia from BNPB and USFS and the first batch of ERAT Asian members. She was actively involved in ACT Alliance and currently is a member of governing board of Red R Indonesia and Red R Australia. She was the one who initiated a community-based mental health model, empowering self-help groups, campaigns, and education with youth groups, policies, and regulations at the local level for the rights protection of persons with psychosocial disabilities. Okay, Mrs. Arshinta, you have 25 minutes. I will give notification 10 minutes before the allocated time ends. Okay,
Thank
Mrs.
you.
Arshinta, the time is yours.
Yeah, thank you so much, Mbak Kidung, for the opportunity. I also share my gratitude to Bulia that allow me to share the sessions from the field experiences. Do you see my screen clear, Mbak Kidung?
Yeah, it already appeared on the screen.
Okay, thank you. My sharing will be outlined until with three components, friends and participants, the context of COVID in Indonesia and some challenges that we face in the field, and also brief introductions, even though Ibu Penny and also Bulia has mentioned, but I also would like to provide brief introduction about Yakum and also what we do in the community level during the COVID pandemic as the complementary informations to what Bulia has been sharing with you all. If we see in the global level up until September 7, Indonesia has reached more than 6.3 million confirmed case, and also the number of death is up to more than 157,000. And if we compare with the global figures, it is obvious that Indonesia contributes like 1 or 2% of the total in global level. And as Bulia also already said, that the level of testing is also apparently quite low. If we come down to in the regional level, Southeast Asia in terms of vaccine coverage is showing quite high, 67.05% until second dose, and for the booster, actually Southeast Asia is only 16%, and it is apparently quite below compared to Western Pacific. And these figures, and we can compare it to the national level, while having informations that regional level, Southeast Asia actually only 60%. According to the Kawal COVID data up to September 4, Indonesia vaccine dose is actually higher than these figures. Yeah, you see, these figures only 67%, but our national data show that dose 1 and dose 2 is a lot higher than the 67% in the regional level. But also compared to regional number, the booster is 26 and 27 for each booster 1 and booster 2, or we call it dose 3 and dose 4. So apparently, compared to regional level, Indonesia in terms of vaccine coverage is higher than the regional number. The targeted population as per our population is more than 234 million. And if we see the data in website Kawal COVID until now, accumulatively, Sorry. Sorry, Mbak Kidung. I think I press. Mbak Kidung, am I still in the Zoom?
Yeah, still in the Zoom.
Okay. I think I pressed something. Yeah, let me continue. The positivity rate is far beyond WHO level. WHO level is only 5%, but Indonesia up to today, September 4, is 7.3% the positivity rate. And even for a few city like Jakarta, even the rate is quite double, 40.3% the positivity rate. Let us continue to the challenges. Of course, we have already heard from the previous resource person from Thailand. One of the challenge is vaccine hesitancy and risk communications. Even though the government already put some efforts, like Ministry of Religious Affairs, Ministry of Communication and Information, put some effort to boost the vaccine participations. We have some challenges in the communications because for instance, Ministry of Religious Affairs already engaged prominent religious leaders to announce calls on the importance of vaccines. Also, the Ministry of Communication already released regular updates on hoax controls. But we see still vaccine expired is still reported, even though we do not have the quantitative data, but that's actually one of the consequences of this vaccine hesitancy. Also because vaccine proof is required to access some public facilities, especially nowadays for flying between city or between island. For some person, for some communities that do not want to get vaccinated because vaccine hesitancy, they pay what we call jockey, vaccine jockey. So they pay somebody else to on their behalf to get vaccinated. So it actually created a false immune system, and also relatively low vaccine coverage due to various reasons. Yeah, and this is was it some examples of hoax that we can have it checked with the website of the Ministry of Communication and Informations. Other than vaccine hesitancy and risk communications, this is what Yakum observed during field operations. Less access to vaccine due to was it not possess or not have an ID card, and it is quite typical for at least groups such as elderly, and typically happen amongst the transgender society and people with disability because they are stigmatized, especially people with psychosocial disability. In our term, we call it orang gila or orang dengan gangguan jiwa. Some of them do not have ID card and they cannot claim vaccine access. Also lack of adequate accommodation. So if even though some of the athletes, we call athletes or komunitas rentan, would like to go to the vaccine meeting point, they cannot really access it because the lack of accessible accommodations. And also mobility issue, distance between health facilities. Later on, we will share with you some video that shows the distance, especially in remote areas. Also lack of adequate storage because of course, some vaccine is only durable until 6 hours, and usually the distance doesn't allow us to achieve was it the target group within 6 hours. Also, coordinations and mapping and sharing resources is also a challenge, especially when we come into a bigger coordination level like district level or even province and national level. That's the challenges that we observe in the field. And who Yakum is. Yakum is established in 1950 and works in more than 300 villages in disaster areas, remote and marginalized areas in Indonesia through 12 hospitals, few clinics, 3 Institute of Health Education like Stikes Bethesda, and 3 community development and humanitarian units. We have community development Bethesda, Stikas, was it Yakum Emergency, then and Pusat Rehabilitasi Yakum. Yakum is envisioned by a quality, integrated, and inclusive healthcare. We would like to achieve it, and it can be achieved with employing more than 5,000 staff, which who are work on the values of compassion, trustworthy, gratefulness, and within the working ethics of living in moderations or keugaharian, hidup sederhana, hardworking and giving under the culture of continuous learning and anticipatory. We believe in the importance of partnership and networking. That's for IACUM works with hundreds of local government units and ministry, development agency, community groups, churches, university, and private sectors. And we also one of the founders. Additionally, I just add it on that we are also the founder of Interfaith National Network, together with colleagues from Muhammadiyah and NU, as well as Caritas and Hindu and also Buddhist. With such effort throughout 70 years, IACUM has made a change in the life of more than 60,000 persons with disability, more than 2 million disaster-affected population, more than 200 HIV/AIDS positive, and many more people in it. And that's the second part. And the last part is what we are experiencing in increasing the access to COVID pandemic tests, tracing, and treatment. I would like to, as because the time is limited, I will show you what we are doing in terms of vaccine access. We actually apply at least three strategy to increase the vaccine access, because data show that vaccine access is relatively low compared to, of course, the developed countries. The first method that we apply is drive-through vaccination method. The data collection were carried out by PKK, Family Welfare Development Task Force, in the desa level, in the sub-district level, with church and volunteers, as well as the health cadres in the community, as to what Ibu from Thailand also said, the importance of community cadres or health cadres. Design preparations to provide accommodation such as transportation facilities, also caregivers, also a sign language interpreter or translator are provided to ensure that people who do not access to vaccine can have it. For instance, for people with psychosocial disability, they do not need to get off from the vehicle, because if they get off, they will be kind of dizzy because there are quite a hectic environment. So this is one alternative that we do with the involvement, the engagement from other stakeholders like government, media, business, academic, and societies. We call it pentahelic method, pentahelic approach. And the second method we apply is door-to-door vaccination method. In this regard, community and religious leaders are engaged in identifying the community members who have not been vaccinated and providing education. This is a very effective approach if we are talking about the difficulties in providing data. Data is one of the most issue in accessing the vaccine, and involving, engaging religious leaders, community leaders. We call it tokoh masyarakat, tokoh agama. They are the ones that know their community members very well, so they know who have not been vaccinated. We also was it facilitate the process to get the temporary ID cards, because because of stigma, discrimination, some like transgender community, people with disability, especially called orang gila, they do not have ID cards because they are not they are stigmatized. So with educations, with coordination with relevant stakeholders, we can get them into the system so they can get the vaccines. Uh, we also complement the vaccination with medication provisions. Some of the elderly, they got so anxious, and the time when the vaccine team already in front of the house, they got the hypertensions, they got all the symptoms, so that we provide the team with medication provision, so that vaccination can be continued, can be done. Also, transportation support for people who had difficulty to access public health center or coming to mass vaccines. Of course, we also consider the importance of family members or caregivers. So they are also get vaccinated because they are the one that accompany the at-risk groups like people with disability or the elderly. Involvement of counselor also important to provide psychosocial support, and it is also one facilities or one service that we providing together with door-to-door vaccine method, as well as involvement of disability organizations to provide educations, information, and peer support for people with disability whose limited information. The last method we do is communal vaccination method. We provide the closest access point or meeting point and ensure a suitable location to resolve the barriers for people with disability and elderly. So we ensure we pick the place together with Puskesmas, together with the community leaders and government, which one the place that are suitable in terms of distance. But if they are not accessible, then we provide was it we call it a hand railing will was it a hand ramp railway that can be placed from place to place, so it's not a temporary structure. We also uh, see the effectiveness of communal vaccination method is because people are getting together and they see that other people are coming, so I will be okay. So people are motivated for taking vaccine. Also easy to refer to adverse events following immunizations, because then after 30 minutes they are observed, and if it is okay, then they can leave the place. And we have good support from the government's primary health center. So they are the one that also have monitoring it and also sit with the health data checks. With such approaches, door-to-door, was it drive-through, we can provide first vaccine access for transgender community in Yogyakarta last year, and this is the testimony that is given by the transgender society, because they are one of the most discriminated community member in our society. And let me check. I still have time, ya, Mbak Kidung. And those surface, those achievement, those progressive field operation was the fruit of dynamic process in the organization level. Bulia has already shared about what Yakum does for addressing the COVID pandemic with what we so-called Petisda Yakum Care Center. And let me show you. This is one of the result why we are able to serve quite huge populations in terms of vaccine access. This is particularly I took the examples of Jakarta. That's the second worst province after Jakarta during the Omicron. The isolation's bed occupancy ratio, Bulia mentioned about 60, 70 something, and at that time, 2021, the board stood at until 90%, and even for the ICU is until 95%, which is far overstretching the healthcare system. And more specifically, also the fact that in Yogyakarta at the time also has the Merapi volcano alerted. So it will potentially bring us into complex emergency situation. We have pandemic, we have the disaster calamity. Considering that, I will not go into detail, but what we provided at that time is a hotline service. You saw the movie, also capacity building. We train until thousands of community members, the RT, RW Satgas. We also complement our service with supporting the COVID patient with oxygens, vitamin, consultation and medicine, also distribution of PPA, as well as it is important advocacy to access vaccine, especially for people with disability, psychosocial disability and transgender who do not have ID card. And this is possibly done because of collaborations between the hospital, between the health education institution like stickers, and also community organization like CDB, like community development, humanitarian, and also rehab center. Despite all the challenges that we mentioned previously, this kind of platform, the joint platform, British Jaya Home Care Center, able to support almost 3,000 people until August 2021. And last point I would like to mention, uh, we would like to learn because the learning organization is one of our commitment, our value. So we did what we call was it qualitative analysis to know what is the contributing factors of the success of such joint platform and what is the challenges and what we learn and from this exercise and what should be the recommendation for the future. I will not go into detail because of the time, but I will get you through the findings. There are 5 findings why this system, this platform was functioning well because of the vision and value, because of the management of the partnership, because of the process of the partnership, and also the process itself. The vision and values, what we learn is that because partnership is prioritized, it is underlined in our strategic plan. You have to have partners, you have to work with other organizations to provide to excel best. And this is what we do during COVID with the hospital, with the stickers, as well as with the community-based organizations. And in terms of partnership management, we use what we call incident command system, which have one commander with one vision, one direction, one was it directive, but it is supported by this structure. You can contact stickers if you like to more because we also can provide training about incident command system. But what we learn is that the structure enables decision-making process made fast, but also we can have a good coordination, share the informations from one division to another division, and it makes the decision-making process is robust and effective. And the interactions with other organization and partnership interaction, it is important to brand us who will what our promise to the society, what our promise to the community. Bu Penny said Yakum is serving with heart, yeah. And branding is not about logo. Branding is about what we actually do to our society, and that's the things that make our partnership does was it effectively functioning. And the process we learned through the trainings that are provided to the society, to the community members like the RT/RW task force, to the members of transgender society, members of disability groups, we actually learn ourselves. It is also a training for our management and staff. And this is something that then lead us to another innovations. That's the achievement. But there are also challenges. The most challenges is difficult. It's not easy to align interest. This is not easy to make we are coming into one voice. It is not always easy to map resources. Resources is one of the challenge. Even government say they reallocate budget, etc. This is one challenge. I would like to point it out the solution. The solution is it is important to make was it partnership as our organizational habit, as our values, and this is solutions to the challenges that mentioned previously, the difficulties to align interest. Addressing the difficulties in resource mapping, one solution is that we have to actively attend coordination meeting according to our mandate stickers because they are health education institution. They can bring their capacity, their mandate as education institutions to such coordination meetings. Then at that coordination meeting, we can observe who can contribute what. So this is one thing. And also the importance of sharing informations, update and findings. And that's making our response accurate and relevant to the society that we are serving. Another challenge is difficulty in increasing outreach. We are talking a lot about was it access difficulties, and one of the solution is involving the community volunteers and specialized community civil society organization. We are working a lot with transgender society. We are working a lot with elderly groups. We are working a lot with the disabled people organization. They are the ones that know their members very well. Also, don't forget to provide reasonable accommodations, because we are talking about increasing the access of those at risk group to achieve to access their rights, which is vaccine. And to interoperability gap, the solutions that we observe at the time is collaboration with multi-stakeholders. That's important. And also one thing that it is our brand is that in Javanese term we call it nguwongke. We have to consistently apply people-oriented approach. We have to pay respect, admit of those difficulties and chaos and also disagreement. We know that government, faith leaders, community leaders, relevant actors, they would like to do good. So we approach when we advocate the needs of people with psychosocial disability, transgender society, we always put a people-oriented approach. This will be the solutions to address such challenges. There are set of recommendations. Participants, you can read it yourself, but we with this qualitative analysis, we built a set of recommendation to CSO, to local government, to regional actors, as well as a donor or funding agency. But the highlight or the keyword of those recommendation is invest in local level, like the movie that was presented from resource person from Thailand, the WHO spokesperson say the local people is the one that making difference. I stop my presentation here, and I would like to ask the panitia, the committee, to play the video. Thank you, Mbak Kidung. Back to you. Mbak Kidung.
Kegiatan vaksinasi ini untuk menjangkau kelompok-kelompok rentan. Jadi kelompok-kelompok rentan ini memang kita butuhkan terjangkau. Karena apa? Karena dia merupakan kelompok rentan yang harus dilindungi, tetapi mungkin aksesnya terhadap vaksinasi ini belum bisa optimal.
Di bulan Juli hingga September 2021, cakupan vaksinasi di DIY masih relatif kecil. 40,53% warga telah divaksinasi di bulan Juli, 57,27% di bulan Agustus, dan 81,95% di bulan September.
Teman-teman yang lansia, kemudian teman-teman difabel itu entah susah mengaksesnya, entah tidak dapat informasinya atau tidak tahu, terutama bahkan ada yang menolak vaksin karena informasinya belum dapat. Jadi itulah kenapa kami ingin menyasar kelompok most at risk yang benar-benar terpinggirkan atau belum mendapat akses.
Misalnya saja lansia, banyak lansia kemudian komorbid. Mereka harus stay di rumah, mereka bed rest, mereka nggak bisa kemana-mana. Kemudian yang kedua itu disabilitas. Dengan berbagai hambatan, baik itu hambatan tuli, hambatan netra, hambatan sensorik dan sebagainya. Mereka kesulitan juga mobilisasi karena jalan untuk ke puskesmas itu juga cukup jauh.
Kami beruntung sekali dalam kesempatan program ini kami juga istilahnya bisa melibatkan berbagai pihak, kita sebutnya pentahelix. Jadi pemerintah pasti dengan Dinkes, kemudian ada puskesmas, kemudian kami sempat berkolaborasi dengan militer juga. Kemudian ada akademisi, jadi ada teman-teman dari Stikes, Bethesda juga membantu kami dalam rangka screeningnya atau bahkan tenaga vaksinatornya. Kemudian ada media juga membantu kami. Kami ormas, termasuk ormas, dan kemudian ada kader, ada pemerintah, desa, juga tokoh agama, tokoh masyarakat itu membantu kami. Plus kami juga ada kesempatan berkolaborasi dengan private sector.
Nah, bagaimana juga di dalam respon ini sehingga yang dilibatkan itu tidak hanya teman-teman yang kemudian masyarakat saja seperti kader gitu, kemudian satgas desa, tapi kita juga melibatkan dari organisasi-organisasi disabilitas yang ada di Jogja. Contohnya seperti Gerkatin. Kita juga bekerja sama dengan Divagana.
Kalau dari awal, pertama pasti kan kita teman-teman relawan itu nyiapin peralatannya. Jadi kayak misalnya tensi atau termogan. Setelah itu mungkin beberapa ada yang kita harus ke dinas kesehatan untuk ngambil vaksinasi. Tapi beberapa tuh ada yang kita cuman perlu ke puskesmas untuk ngambil vaksinasinya. Nah, setelah itu baru kita mungkin ketemuan sama Pak Dukuh atau kader yang ada di lokasi untuk nunjukin tempat-tempat yang akan divaksin lah istilahnya. Nah, setelah itu baru kami, teman-teman relawan, berangkat untuk vaksinasi door-to-door itu. Selama vaksin berlangsung itu, tantangan yang sering dihadapin itu, yang pertama pasti medan. Kadang itu karena kita door to door, jadi kita nggak tahu medannya itu seperti apa. Kadang ada yang harus naik turun gunung, ada yang hujan-hujan juga, kayak gitu. Jadi mungkin tantangan terbesarnya medan. Kemudian yang kedua itu, kadang ketika kita udah sampai di rumahnya, itu tensi dari orang yang akan divaksin itu tinggi. Jadi mau nggak mau kita tunggu atau bahkan nggak bisa divaksin sama sekali. Kalau untuk teman-teman ODDP, mungkin kita ngobrol sama pendampingnya ya untuk diberitahu kalau kita mau melaksanain vaksin yang kayak gitu. Atau mungkin kita juga minta tolong kader atau Pak Dukuhnya itu untuk memberitahukan ke ODDP-nya kalau kita akan mengadakan vaksin. Kemudian kalau untuk teman-teman disabilitas, kita juga ada kerjasama dengan JBI atau Gerkatin atau JP atau Gerkatin itu, nanti mereka yang ngebantu kita untuk komunikasi sama teman-teman yang difabel itu.
Saya di sini membawa teman-teman YEU ke tempat-tempat yang menjadi sasaran vaksin hari ini. Di mana teman-teman YEU belum tahu lokasi rumah orang-orang yang perlu divaksin. Jadi, saya mengajak dan mendampingi tim YEU ke rumah orang-orang tersebut, karena saya yang tahu lokasi rumah peserta vaksinasi ini.
Kalau saya terlibatnya terutama di pendampingan, Mas. Selain di pendampingan, saya juga mencari data teman-teman yang untuk divaksinasi.
Jadi vaksinasi nggak bisa satu orang, harus secara komunitas. Kalau komunitasnya terpenuhi vaksinasinya, harapannya dia bisa memberikan kekebalan bagi yang lainnya. Gitu. Kalaupun nanti kelompok-kelompok rentan ini terpapar, ya mereka udah punya antibodi. Harapannya di situ. Udah aksesnya sulit, tinggalnya di tempat seperti ini ya, akses kesehatan susah didapatkan. Sayang sekali kalau mereka kena COVID, gejala berat, ngangkutnya aja udah susah gitu. Jadi kita masuk ke upaya preventifnya, pencegahannya sih.
Mencegah penyakit atau sehat. Saniki nggih boten wonten pripun nggih biasa kados sebab sedereng divaksin.
Nggih sekecap. Yuk disuntik niku rak dilase sakit to. Niku yuk Pak, pulih mboten lara meneh.
Mboten ngeras menapa-menapa. Kadang mboten nonton keluhan itu. Ae.
Sejak September 2021 hingga Februari 2022, program vaksinasi YEU telah menjangkau 6.714 orang tanpa disabilitas dan 130 orang dengan disabilitas.
Harapannya sih semoga vaksinasi ini bisa terus berlangsung ya, karena untuk masyarakatnya yang masih belum bisa terjangkau. Kemudian mungkin juga edukasi yang lebih mendalam sih untuk keluarga-keluarga yang masih menolak vaksin, seperti itu.
Kalau harapannya untuk secara khusus ke teman-teman disabilitas itu untuk bisa tervaksin semua ya. Baik mereka yang tidak bisa mobilitas maupun sudah bisa mobilitas, karena banyak teman-teman kita yang tidak bisa mobilitas akhirnya mereka tidak tervaksin. Alhamdulillah kita ada pendukung dari YU, kita bisa melaksanakan door to door. Harapan kami untuk kedepannya tidak hanya dari YU tapi dari lembaga-lembaga lain yang bisa membantu kami untuk vaksinasi secara door to door.
Thank you, Mbak Kidung.
Okay, thank you, Mrs. Arshinta, for the sharing. Dear participant, if you have any question, you may type down your question in the chat box in the following format: your name _ country _ speaker _ question. Coming up next is the question and answer session. I would like to open 3 sessions with 2 questions in every session. This time is for Dr. Rung Rawi. The first question is from Laura Santi Cynthia from Indonesia. And the question is, regarding the barriers to community nurses during the COVID-19 pandemic, do nurses in Thailand community get negative stigma from the community because they are in a close contact with COVID-19 patients? And how do community nurses in Thailand deal with this situation so that people are not afraid and give negative stigma to community nurses? Dr. Rung Rawi, is my question clear?
Yes, from the question that I copy and paste and translate into English for make understand clearly for the answer, I would like to share my slide a little bit that I did not tell your audience. Okay, can I share my slide?
Yes, sure.
Okay. Okay. For Q&A, the first that Liski Windy Putra, he or she asked me in Indonesia, then I translate into English like this. What are the current conditions in Thailand? It is free in Thailand not to wear a mask. And are there any COVID-19 victims so far? And is the role of nurse very prominent in dealing with COVID-19 in Thailand today? Is it right? It is the same question that Risky would like to know. So the first of the question, the current of the condition in Thailand now, approximately 1,605 new cases in the last 24 hours. And approximately the number of the 4,006,000 approximately cumulative case, and 3,000 to 10,000 and 2,000 cumulative deaths, and approximately 81% people receive the vaccination. This is the situation in Thailand. I thought it is quite nearly in Indonesia, like Miss Ashita described it. It is okay. Next, it is free in Thai not to wear a mask. Is some people from foreigner, we did not limit them to wear the mask, but for the Thai people now, we've got new normal and we awareness about contact to another people in public health or in public area. So everyone or near everyone have wear their masks on face, especially in public, such as the concert or the public area in the school, in the classroom. The teacher have to tell them should wear mask on your face to prevent COVID-19. It is quite the severity of disease quite low because we have a lot of vaccine. So even though they not severity right now, but we awareness to put the mask on our face. And this is the new normal for the nurse, especially in community and in the hospital. We have to wear masks every time when we contact to the patients. It is quite the rule and the routine of the procedure that we have to put the mask on our face. And the next question, are there any COVID-19 victims so far? Yes. Anyway, according to vaccination provided to people, the people who received the vaccine at least 3 doses, they had few symptoms such as cough, pain in the throat, but not in the lung. They not receive severity in the lung. It is quite small and low symptoms of the severity COVID-19. And the next and the last of the question, is the role of nurse very prominent in dealing with COVID-19? Yes, very, very important because the community area in our country, including 72 provinces, each province has at least 10, approximately, not at least 500 communities in each province. So this is the teamwork very large in our country that try to work hard and try to help people in the community to prevent and receive curative management, to provide prescribe the medicine, and they do everything in the community for the people in Thailand. So the community nurse have promote resilience and quality of life, achieving targets, outcome, and social impact that include social connectedness and sharing. So I thought that the community nurse in Thailand can eliminate and reduce barriers such as individual problems and organization challenging of caring for patients with COVID-19. It is clear?
It's clear already, Dr. Rungrawi. You already
Okay.
answered all the questions perfectly.
Okay. Thank you very much.
Thank you, Dr. Rungrawi, for the answer. Now let's move to the next question. This time the question are for Mrs. Nurlia and Mrs. Arshinta. We already selected 2 questions per person to be asked. And the first question is for Miss Nurlia first, okay? The first question is from Tuti Retnaningsi from Indonesia. And the question is, in relation to the stigma in positively infected patients, they don't want to be isolated. This is one of the barriers in treaty implementations, right? And how is the strategy that we can implement to overcome the problem?
Thank you so much for your question, Miss Tuti. I would like to answer. This is on the problem, the stigma in the pandemic, so we cannot implement it about testing, tracing, and treatment. But we can prevent it and can reduce the stigma in the community. Maybe we can correct negative language that can cause stigma by sharing accurate information about how the virus spread. Speaking out again negative behavior and statement, including those on social media. So social media is important thing to share to reduce the stigma. Making sure that image used in communication so diverse communities and do not reference stereotypes. So we can do it using media channels, including news media and social media, to speak out against the stereotyping group of people who experience stigma because of COVID-19. And then taking healthcare workers, responders, and other working on the front lines, suggesting virtual resources for mental health or other social support services for people who have experienced stigma or discrimination. So maybe we can ask people with discrimination and share their experience about it, so everyone can know about their feelings, something like this. And then this is a rule of nursing, provide education in the community. Maybe they put the stigma because they don't know about the clearly about the COVID-19. Maybe this is my answer. Is it clear?
Yes, it's already clear. And thank you for the answer. Now we are moving to the second question for Mrs. Nurlia. And the question is, because most of the people doesn't want to be tested due to many stigmas in society, they are afraid if the result is positive, or they are afraid that they cannot do daily activities. How do we respond to this in relation to 3T implementation?
Okay, thank you. This is I think this is a significant role of nursing, how to collaboration with the community. In Indonesia, we have like a Satgas COVID. They will provide, educate the community. They will know about the COVID-19 and they can support the people with COVID-19 to self-isolation at home. So the local leaders is important. He can be like a role model to share their knowledge, to share and their behavior to the community, so we can reduce the stigma. Maybe like this, is it clear?
Okay, it's already clear. I'm highlighting the point that we in Indonesia have Satgas COVID that provide all the services. So if people didn't want to get tested, maybe Satgas COVID will make a move so the community can be test, trace, and get treatment for the COVID-19. Okay, that's all. Thank you so much for the answer, Mrs. Nurlia. Now we are coming up next to, we are continue to the question for Mrs. Arshinta. And the first question is from Novia Fitri Wulandari from Indonesia. And the question is, what is the differences between vaccine doses 1 to 4? Will there be another dose of vaccine? Is getting 4 doses of vaccine enough?
answer it directly, Mbak? Mbak Kidum? Yeah. Okay. Thank you for the questions. Actually, I think I'm not the eligible persons to answer such questions because I'm not a medical person. But and also Bulia or Miss Rungruawe can help me answer it. But if we read from the references, the purpose of the prime series of dose, like we call it dose 1 and dose 2, is to prime or to start the immune system to develop immunity against the target pathogen, in this regard COVID. While the purpose of the booster dose, which in this regard is booster 3 and 4, is to boost the already existing immunity to ensure continued protections against the pathogen, in this regard COVID pandemic. I think I'm not the proper person to answer whether after the dose 3 or after the booster first there will be a continuations of other vaccinations, because this is a complex issue. If you like to know more detail, you can search also some references. But the bottom line is that now COVID already merged not only a pandemic, but it already comes into endemic. So maybe the approach will be different. And if we are talking about still about having vaccinations, uh, the future system will um, not only provide free vaccine, but also in the long future, if we are talking about endemic, if we are talking about the development of this virus itself, uh, the relevant or various actors like government also observe the potential to have it was it purchased or made it available by uh, the the other party. So it's not always government that provides. So we are not very sure how it will continue. But at least at this moment, Indonesian government focuses on booster first or dose number 3, with was it hope that it will increase or strengthen the immunity of the society. I hope I answered you a bit, Mbak Novi, even though maybe not very 100% satisfied. Mbak Kidung, next question.
Okay, thank you, Mrs. Arshintan. Now we are coming to the second question from Glass Cindy from Indonesia. And the question is, what are the other barrier for the transgender to get vaccine?
Thank you. That's a good questions. Uh, as I mentioned in my presentation, the in possessor or there's the one of the first barrier is transgender society, and also in some other context person with psychosocial disability, because even before pandemic they are highly discriminated. They do not have ID. The other barriers is actually the priority in livelihood, because pandemic, as all of us know, really hit the economic of the society, of the whole nation, and even the whole world. And transgender community, they at some point they say it is better to die. What this I quoted their own very own statement. They told us it is better to die before because of COVID than die because I'm hungry. Livelihood priority or problems in economy is one of the barriers. So they do not really focus. Besides information, of course, they do not really focus on the informations or the provisions of vaccine, because they think it is more important for them to keep working, and they also lose their was it source of livelihood, so they have to really struggle on provide their economic economic need. And the other the other barriers is because the informations about vaccines, about the vaccine provision is not in their term, is not using the channel, the media, the language that they are used to. We assume that if we build informations that is channeled through WhatsApp, channeled through YouTube, channeled through whatever digital media is, but the fact is, people from transgender community, people from disabilities groups, they are in the low. Some of them, around 60, 70, even 80% in some contexts, are within the poor level, and they do not have a smartphone. They cannot really buy paket data, we call it in bahasa, quota for accessing internet. So we have to find a channel, we have to find appropriate media to convey, to release, to bring our information about vaccine to them in the way that they are able to access it. And one, according to our field experience, one of the most effective informations deliverable or delivery or media is through the persons that they know very well. Who are they? The community cadres, the community volunteers, people that are trained, and for instance, in our context is was it cadre, and also activists, the people that are active in this network, as well as youth, because some of the youth groups are also volunteering in this kind of network. And I think I encourage this very important meeting in the seminar, because we are talking to many, many hundreds of nursing students. I encourage you to also participate in this regard, because then you will be exposed to a very good opportunity to know the need, the communication need, the information need, the health information need of the most at-risk and the most discriminated society in our groups in our society. I hope I answered it, Mbak Kidung.
Thank you, Mrs. Arshinta, for the answer, and it's already answered all the question. Dear participants, we still have around 10 minutes for this Q&A session. Is there any of you who would like to ask directly to our speakers? You may raise your hand and wait until we give you a permission to unmute your mic and ask. Is there anyone want to ask directly to our speakers? Okay, I think it's already clear for all the participants. If there is nobody want to ask to the speaker, we will continue to the closing statement from each speaker. Let's start the closing statement with Dr. Rungrawi.
Dear all the teamwork of your university, and any kind of the helping that help me to enjoy and involve with this seminar. And I would like to thank you, Dean, and your team, especially Ethic Pub Law, that is used to be my student in Faculty of Nursing. I'm very, very appreciate to enjoy this seminar, and hope that my sharing experience will help you see a lot of barriers in Thailand and compared to your country, both Indonesia and Philippines, that I thought that it is the same situation at the early and the current time. The severity of COVID-19 has like a incident quite low now, and we provide vaccination to prevent severity of the disease and symptoms that make us have a high quality of life again and come back to the normal life. But it changed to the new normal that we still to prevent this disease in all our life. Thank you very much.
Thank you, Dr. Rungrawi, for the closing statement. Next, a closing statement from Mrs. Nurlia.
Thank you, Kido. I would like to thanks to our speaker, Dr. Rungrawi, and also Mrs. Arsita. I think the seminar is amazing moment. We can share experiences to manage COVID-19 in 3 countries, but because Dr. Talosik cannot attend in this seminar, 2 countries, Indonesia and Thailand. So my closing statement is the pandemic can be passed if there is collaboration from various elements by involving the community. So the community is an important element to manage the pandemic. Thank you, Kidung.
Thank you, Mrs. Nurlia, for the closing statement. And last but not least, a closing statement from Mrs. Arshinta.
Thank you, Mbak Kidung. I share the sentiment joiners that declared by Dr. Lungrawi, also Mbak Lia. The closing statement that I can share with you, you see that from the Thailand context, from the Indonesia context, no one safe until everyone safe. So it is very important to ensure that the at least or the at risk, the most vulnerable, the most discriminated community group have to also be able accessing their rights in accessing vaccine. Uh, in this regard, I will say that actually inclusive approach is not an option; it is a necessity, and I think because most of the attendants of this seminar is nursing students, you are in the very well positions to harness your interest, to harness your skill in this valuable seminar to uh, to respect to learn about having more inclusive approach. How is it? What is the respectful communication? What is the right appropriate terminology to address our the society that we are serving as a nurse community nursing? And I think started from the school, started from the university. It is the best opportunity. It is the right moment to harness and to equip yourself to be the excellent health agents in our community. Last things that I also would like to say, as repetitively experienced, stated, and heard from our speakers, also from the video that we saw from Thailand and from Indonesia, the importance of community participation is not deniable. It is very, very key to successful health program, especially learning from the pandemic. Community participation is a key, and also to have effective multi-stakeholder coordinations and collaborations in local level. So I think as nursing students, beside learning and harnessing your skill, your values, your knowledge about inclusive approach, the second one to learn is how we as a nursing community nursing students harness our ability, our skill to facilitate community participations, to facilitate local collaborations among stakeholders. I think those key messages, I think motivating, I hope motivating our participants and will be takeaway from our seminar. Thank you, Mbak Kidung, back to you.
Thank you, Mrs. Arshinta, for the closing statement. Ladies and gentlemen, we have come to the end of this plenary session. Once again, thank you for all the speakers for sharing your valuable knowledge and experience. And also, I would like to thank all participants for actively taking a part in today's international seminar. Thank you and God bless you. Elena, back to you.
Thank you, Kidung, for guiding the seminar today. Ladies and gentlemen, today's event is a great collaboration between Bethesda Yakum Institute of Health Science, Health Polytechnic Karya Husada, and Jayapura Institute of Health Science. Here is the video profile of Health Polytechnic Karya Husada.
Kesehatan Karya Husada Yogyakarta beralamat di Jalan Tentara Rakyat Mataram Yogyakarta nomor 11B telah terbukti berhasil membentuk tenaga profesional di bidang medis melalui jenjang pendidikan Diploma 3 Kebidanan, Diploma 3 Keperawatan, dan Sarjana Terapan Promosi Kesehatan. Berbagai keunggulan seperti pembelajaran teknologi informasi, terapi komplementer, penanganan gawat darurat, dan promosi kesehatan bencana. Politeknik Kesehatan Karya Husada Yogyakarta juga dilengkapi fasilitas penunjang yaitu perpustakaan yang nyaman, laboratorium kebidanan, keperawatan, dan laboratorium pembuatan media promosi kesehatan. Tunggu apa lagi? Ayo segera daftar dan wujudkan cita-cita menjadi tenaga kesehatan atau tenaga promosi kesehatan yang profesional bersama Politeknik Kesehatan Karya Husada Yogyakarta. Kuliah di Politeknik Kesehatan Karya Husada membuka wawasan yang luas dalam dunia kerja. Menurut Bagus Indira Wahyu, Poltekkes Karya Husada Yogyakarta membekali lulusan dengan kompetensi dunia kerja serta bekal kewirausahaan. Nala Sahita Putri merasa Politeknik Karya Husada adalah tempat kuliah yang nyaman dan sangat mendukung kompetensi lulusan sehingga setelah lulus langsung dapat bekerja. Bagi Nuraini, suatu keberuntungan kuliah di Poltekkes Karya Husada Yogyakarta. Dengan bekal ilmu selama kuliah, sekarang ia telah memiliki lapangan usaha sendiri yaitu Baby Spa Kids Jogja. Makin yakinkan untuk bergabung di Politeknik Kesehatan Karya Husada Yogyakarta? Ayo segera daftarkan diri dan jadi profesional seperti Bagus Indra Wahyu, Nala Sahita, dan Nuraini.
And now, I will announce the lucky participants from Indonesia who are chosen to get a gift. Congratulations to all lucky participants whose names are displayed on the screen. The committee will send you a direct message on your chat box. Here is the video profile of Jayapura Institute of Health Science. Dear participant, let me remind you once again to fill out the evaluation form. The link is provided in the chat box. Don't forget to fill it out soon because it will be closed within 1 hour after this seminar is ended. The materials from the all speakers and e-certificate will be sent via WhatsApp group in the form of a Google Drive. It will be open for a week before we close the access. Let me remind you that the e-certificate is only given to the participants who attend the seminar from the beginning to the end. If the participant does not get a certificate, please contact the committee by attaching a screenshot of the registration and evaluation that has been filled in. After this plenary seminar is over, it will be continued to the parallel sessions. There will be 76 presenters for today's parallel sessions. The parallel sessions will be started at 1:15 p.m. on different Zoom room. Please join the room 15 minutes before we start the parallel sessions. Ladies and gentlemen, let us end the seminar by praying, thanking God the Almighty for His guidance throughout today's seminar. I will lead the prayer in Christian way. For those who have different belief, kindly support us in your prayer. Let us pray. Almighty God, we started this seminar with you and we are closing it with you. Thank you for blessing us during this seminar. We are blessed by learning from the perspective of each person in this room. We thank you for the insight that we can receive from one another. May things we have learned today stir our hearts, and may we put them into action, so that we may go out and spread what we have learned in the spirit of your love and generosity. May all glory and honor come back to you in everything that we do. Thanks God, we believe and pray. Amen. And then, we will take a picture with the participant and our speakers. Dear participant, please open your camera. We will take a picture together. Okay, everyone, let's take a picture together. 1, 2, 3. Please always smile and give your best poses. Okay, we will take another picture. Let's take again. 1, 2, 3. Okay, we will take another picture to the next slide. Let's take again. 1, 2, 3. We will take a picture for another slide. Let's take again. 1, 2, 3. Okay, it's clear. Ladies and gentlemen, we have come to the very end of this seminar. On behalf of the committee, I would like to thank you for participating throughout this seminar. I am Elena, your host for today, asking for your apologies for any misconduct I did that might cause discomfort for you. Stay well, stay healthy, and keep following the health protocols. May God bless you all. Ladies and gentlemen, our closing performance, a song from White Angel Choir, the student choir group of Bethesda Yakum Institute of Health Sciences.
Thank you.
Dear participants, we will continue to the next session, that is parallel session that will be start at 1 Western Indonesian time. So, for the participants registered in the parallel session, you may stay in this room or you may join us at 1 with the same link. For those who are not registered in the parallel session, please kindly leave the room. Dear participants, we will continue to the next session, that is parallel session that will be started at 1 Western Indonesian time. So for the participants registered in the parallel session, you may stay in the room or you may join us at 1 with the same link. For those who are not registered in the parallel session, please kindly leave the room. Thank you. Kepada para partisipan, kami akan melanjutkan ke next selanjutnya, yakni sesi paralel, dan ini akan diselenggarakan pada jam 1 WIB. Kemudian untuk para peserta yang terregistrasi bisa untuk stay di room Zoom ini atau bisa untuk join kembali di link yang sama pada jam 1 siang. Kemudian untuk yang tidak terregistrasi bisa meninggalkan ruang Zoom tersebut. Terima kasih.